good morning again, and welcome to this beloved space where we're going to have our first Children's Policy and Power Plenary. My name is Brandy Taylor Day, and I have the pleasure and honor of serving as the state director in Texas. And I have the distinct pleasure of being able to moderate this panel this morning with these amazing guests who I will introduce here shortly. You know, we're living in such an urgent time right now where we must gather together for collective action on behalf of children and families. Often, unfortunately, right now, you know, children are treated as problems to be managed, rather than the sacred lives to be nurtured. And so we have a responsibility during this season. We have a responsibility. So during our time together, during this session, we're going to really be called to shift that paradigm towards systems of care, policies of compassion, and communities of holistic healing. And so this morning, we are joined by two prophetic voices. How about that, y'all? Who not only study systems, but also work to transform them. Our first panelist is Reverend Dr. Norbert Wilson, who serves as the director of the World Food Policy Center and is a professor at Duke Divinity School. He is a scholar, he's a servant, and a trusted voice in this fight for food justice and economic dignity for all families. So let us welcome Dr. Norbert Wilson.
Thank you.
We are also joined by the Honorable Rebecca Jones-Gaston, who served as the former federal commissioner for the U.S. Administration for Children, Youth, and Families. As principal consultant for the Rebecca Jones-Gaston Consulting Group, she brings decades of leadership in reimagining child welfare through a justice and equity lens. Let's welcome Rebecca. So together, today we will explore the promise, the problem, and the policy path toward a nation where every child can thrive in mind, body, and spirit. So are we ready? Are we sure? Okay, all right. We are definitely ready. So let's begin with our opening reflection. And y'all, we're just gonna have a conversation, so we're comfortable, okay? You just join us in this moment. What does it mean to treat child wellness as sacred and shared? What does a healing-centered system look like in beloved community? Jump in.
First of all, good morning. And thank you to CDF and to Starsky and the team. This is my first time here, and you might just see me every day for a while.
Okay.
It absolutely feels like home, so it is an honor to be here. This notion of child well-being is a critical one, and we actually haven't been very good at defining it. We use it loosely, certainly in government and policy. We say well-being, and it gets interpreted in about 50,000 million different ways. And so I think one of the things we've got to do is be really clear about what does it mean for our child to be well. And I firmly believe that in order for our children to be well, their parents and families have to be well, and their communities have to be well. We can't treat it as if, right? And so I'm a believer in possibility. The systems that are in place were absolutely built to do what they're doing. We know that they aren't doing what they need to do for us. Right. And so my philosophy is someone made it up so we can unmake it And what I heard loud and clear yesterday from Sister Alicia is we also have to know what we need.
Yes.
And be able to say that. And so I think that, and I'm looking forward to this conversation, is where we've got to be, is what does it mean for our children to be well and to be thriving, their families, their communities, and then what is it that we need to actionably do to dismantle what exists and know really clearly about what it is that we want to put in place of it.
Absolutely.
No, thank you so much for starting off with helping us think through what is well-being.
Mm-hmm.
And I think of well-being in many ways, but one way in particular, being invited to the table. The table is a place where we can share, where we can remember. And I don't mean just remember the past, but be remembered as members of the community. The table is also a place of healing and wholeness. We are nourished at the table. And therefore, children, and not just children, their families, the aunts and uncles, the cousins, all can find a place at the table. But the table that is empty, well, isn't really much of a table. And therefore, we need to think about how do we make sure that there is always nutritious food on that table. Things that nourish not just the mind and the body, but the soul. And so when I think about what it means to have well-being, it is having a place around the table where love abides. Now, we can't always legislate that. We can't always have policy. And talking with my sister Rebecca, we shouldn't be expecting it necessarily from the federal government because it ain't going to do it. And so I think there's some important things that we as community members need to be engaged in order for that to take place.
Absolutely. Thank you for honoring the difficulty in even defining child well-being, but also knowing what it looks like to each of us. So I want you to think about your work, Dr. Wilson, in the food justice space. How can we move from this charity-based food system to one, that's rooted in dignity and justice, especially for children navigating material poverty and racial inequity? Share with us.
Thank you. I got to be 100% honest with you. When I got this question, I struggled with it. Yeah. And I'll give you a little bit of a background and try to help you understand why this has been challenging. I have had an experience in the last several years working with the charitable food sector. So I've been on the board of food banks in 2 different cities. I've done research in food banks, and I've actually been a pretty strong advocate for food banking. But I moved into a new place where that was really called into question. And I just thought about all of the grandmothers who were working in church basements, trying to provide some food for the people in their community, and they were just listening to the call that Jesus said, "When I was hungry," and there was no guile in that. There was no belief that they were somehow better, and therefore their hospitality was somehow twisted or misaligned. However, I've got to say, I had to hear from some folks that there are problems even with that kind of care. That it is rooted in some complex systems where there are challenges in the way we produce food and who has access and who has control and who can distribute and who then is on the receiving side of it. Now, I've got to be honest with you. I've been into some food pantry settings. I won't name locations. I've been in a couple of different cities, and so I don't want to call out anybody, but I'm just going to say it this way. I remember going to this food pantry, and you had to wait outside. And I got to say, here I was as a college professor, and I was going there to learn and to volunteer and to sort of understand how they were doing what they were doing. And the first thing I was told was, "Oh, wait, you need to wait because it's not time for you're here for food. You have to wait." And there was a part of me that was a little hurt because here I was as a college professor, and I'm sitting there thinking, I'm not here for food, I'm here to help. Why is it that you're thinking, oh, I get it. And so I had to code switch and say, oh, I'm so sorry. I'm actually faculty, and I'm here to learn, and I'm here to work with you all. And they said, oh, okay, come on in. And of course, when I entered into this space, I was only non-white face in the room. It was in a church, and there were boxes, and there were young college students who were helping out, and there were older folks. And as I helped them set up the room, I realized that they set up a series of tables. And individuals who were going to receive food had to walk through the tables to pick up the food. Client choice is a good thing, right? But what was interesting about the way this particular food pantry was laid out is that a client, a neighbor, couldn't just go through the line on their own. They had to have a college student walk with them with the cart, and only the college student could touch the table to receive the food. You know, and it really struck me, and I thought, this is what is happening here. I will say, before that particular moment of going through the pantry took place, they had a devotional. And if I remember correctly, because I went back a couple of times, there was also a Eucharist or a communion. Now, I don't know the faith of the people in that space. I don't know who was there. And so I don't know how they felt to have to sit through this devotion, Christian devotion. I'm a Christian. I'm ordained as a deacon in an Episcopal church. I love Jesus. I have no problem with Jesus. But I also, not only do I not have a problem, I actually love Jesus. But I don't know who was in the room.
Right. That's right.
I have worked with an LGBTQ student who talked about the struggles of LGBT youth to come, or adults to come into Christian spaces to receive food from food pantries because of the hurt and the harm. Even if that church was open and affirming, folks don't feel comfortable necessarily in these spaces. Now, that's not to say we shouldn't do the work, but we have to acknowledge that there are challenges in this charitable food sector. Now, I do want to make a quick point about sort of this tension that I've been feeling around this. There are those who would say this system is failing people because they're sucking up all the money. These are not community members. They are coming in from the outside, that there are racial imbalances that happen. And of course, there are socioeconomic imbalances that happen in these spaces. It is typically not the individuals, the neighbors who are on both sides of the table. It's typically wealthier folks on one side and poorer folks on the other. Depending where you are in the U.S., it may be mostly white people on one side of the table and mostly black and Hispanic and Native folks on the other side. I've been to some where that's not been the case, where it was all of the same race. I say that to say there is a need for us to look carefully about how we do the work of caring for our neighbors through these systems. And I'm raising this to say I have been challenged to be critical and constructive of these spaces. They are important because we know that there are folks who will not be able to access SNAP. And under the current bill that just passed, there will be more people who will not be able to access these systems. So we are not going to see a world where there is less of a need for charitable foods. We're going to see more of a need for charitable foods. All of these organizations that go out and provide backpack programs for children to take food home over the weekends, those programs will need more support. Part of the challenge that's happening right now is some of the things that this current administration has done is actually taken away money that used to go to food banks to do the work of feeding communities, even imperfectly. That is money, and that is support that is needed. So I will stop there and I will pass.
Yeah, and I'm not following directions, so 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 I just want to like add something to that, Dr. Wilson. Is when I think about community responsibility and collectivism, and there are all these things happening in the federal space that frankly are bananas and other words I was asked not to say.
It's all right.
But where we can play a role is, this last election, and frankly, the last few elections, there have been a number of people who have voted against their community's interest because they didn't identify directly with it. And so I think about SNAP, and so the question becomes of, just because you have food doesn't mean that you shouldn't be concerned about someone who does not. And so really thinking about how we're educating ourselves and our communities around our social responsibility to the collective, both in voting, but also in what the actions are that we're doing as a community.
I'm going to just say this. I'm so grateful you
I
said.
support you for not following directions also.
I am going to be supportive. One of the things I think is critical, when interviewing some folks about how SNAP benefits are determined, and I won't go into the details, there was such a disconnect of what this critical policy is and how it works from the lives of people, and some of those were individuals who were receiving these benefits.
Because they're named different things, right? So in the federal conversation, we talk about the federal acronyms, which is alphabet soup. And then at state and jurisdiction level, the names are different, but the funding stream is the same. And so that's the other part of like making sure that we're educating ourselves about that, because I think that really was part of the issue.
That's right.
Y'all keep this going. You're good. No, you're great. You're great. So just Mike. Oh, I'm sorry. I got comfortable.
She was in our living
I
room.
was in my zone. I was in my living room. Yeah, I apologize.
We are
Thank
comfortable.
you. Thank you. I need all these visual cues and reminders. Thank you, Dr. Wilson.
Next time we'll have the little mics up here.
That's right. That's right. Here we go. Let me get dignified again. Okay. So, Rebecca, you've led child serving systems at both the state and federal levels. What must change in how we design health and mental health supports for families, particularly those most impacted by systemic injustice?
So I think one of the things, kind of building on what you said, is we actually have to be at the table, right? And there's been a lot of work in a lot of different areas at the local level, some at the federal, and that's tailing off, but of making sure that there are folks that have actually been impacted by the various systems at the table to actually help the decision makers in knowing what it is that they have to decide. So from my experience, I relied heavily on young people voice, parent voice, community voice, and insisted on it each kind of step I made along the way. And it's not easy, because the tendency for many, many years has been to invite you to then put your trauma and pain on display and make the people in the system say, oh, that's so bad, we should do better. But really, as a system member, the do better is, I actually shouldn't be the one coming up with the ideas. It should be the folks that are most impacted by those decisions, helping think through what that is. And in part, so I'm gonna do this weird, I talk with my hands, so holding a mic is a challenge, is understanding where there's opportunities for change. And so I'm a visual person, so I'm gonna try and paint you the picture that is in my head. So federal government, Congress, they're the lawmakers, they're the ones deciding money. The president submits a budget, it's never what ends up in the budget. Congress is actually the budgeter.
Should be.
And then there's federal agencies who are charged to then take what is law and implement policy. And that sometimes plays out in regulation. Some folks call it rules. And then in program guidance from the federal offices to say to state and local agencies, this is how you do this. And then at the state level, states oftentimes go and make either a mirror law or something similar to it to direct what they're doing as a state related to the same issue. And then in the states, there's regulation and rules. And then there's guidance and implementation. And then there's the individual and the community that's actually impacted by all of those decision points. Well, how many of you all played the operator game, telephone game? I know it's probably dating me because the young people don't know what that is anymore, of like this. But where you start a message and then at the end it's a completely different thing. Well, welcome to policy.
Yeah. Mm-hmm.
Welcome to policy. At each juncture, when it changes hands, there can be a change in definition, understanding, and guidance and use of words that changes the direction of what's going to happen with funding or access or authority. And we, a lot of times, say, well, the feds won't let us, or the feds. Sometimes that's true. But a lot of times, the actual decisions and definitions and direction along the way have completely changed what the intent was at the congressional level. And we, on the ground, in the community, feel like we're powerless to change it because Congress is way over there and I don't talk to them on a daily basis. But what I'm saying is we've got so much opportunity to think about all of those decision points. And I'm not saying ignore trying to change the things at Congress, but there is so much that can happen from the impacted person to the state to then at the federal level that I just think is so important. And so one of the things that is currently going on is this conversation across the nation around prevention, which could, that's a word that gets used around a lot of things, right? So, and I'm in child welfare speak in human services right now, it's in child welfare world, it's prevention of foster care. Well, trying to change that frame and thinking about well-being is, I don't just want to prevent children from experiencing foster care. I actually want to prevent them from even getting to the line of it being something that's a danger to them. Right. And that means community. Yes. Because community and all the things that happen out there are interacting with kids and families long before a child protection agency. And we've taken across the nation, each state has their own definition of safety and neglect and abuse. So that's 52 different, actually now 53 different definitions, right? So the 50 states that I think still exist, DC that,
we don't.
Puerto Rico and the Virgin Islands. The definitions that we have for neglect and abuse include a large number of things that are actually the experience of poverty. And we've turned it into abuse and judgment, and then saying you don't have housing, you don't have medical care, your mental health is not stable, so we're going to go ahead and remove your children until you get that figured out. And then, oh, it took you too long, so we're going to give your children to someone else, right? So there's a push to try and change definitions that are on state books that are driving a lot of this. I was child welfare director in Oregon, and we had I'm sorry to chuckle because it's just like absurd to me. Part of our definition of abuse and neglect was threat of harm. Anybody have children? Full confession publicly, I have threatened to harm them. I hope, and sometimes it's questionable, whether or not I would be able to stop myself from actually harming them. But there's those things. But I'm calling, and there's a 24-year-old, a community member's calling, and there's a 24-year-old on the end of the phone, no offense to 24-year-olds, making decisions based on some third party that doesn't know me about, I heard Rebecca threaten her son that he will never gonna see the light of day again. And then having to make a decision about whether or not they're sending someone to my home to determine if I'm a good enough parent. And full confession, I'm not entirely sure what my children would say. And they're full-grown adults now, so they have survived. I can't quite get them out of my house, but that's a whole other conversation. But what we've done is we've weaponized something that's actually supposed to be available for you when you're in crisis.
Right.
And I think it's similar when you're talking about access to food, access to healthcare, access to transportation. We've weaponized these things and said, well, I figured it out. Why can't you? When a whole bunch of other people don't actually have to figure it out. It just is there, right? And so I think we've got a lot of work within our community to challenge ourselves on how we have bought in to the other perspective and internalized that. And I really appreciated what you said. I'll stop in a minute, Brandy, I promise. What you said about healing, right? The healers needing to heal. I'm technically working right now, but I was not working for 4 months following January 20th. I was invited to not work at the federal government any longer. Yeah. And that's okay, believe me. I've never not worked before in my entire life. So it took me, I'm not even sure I'm fully appreciating it because I felt guilty. I was like, I'm supposed to be doing something. Yeah. What it is, I'm not sure. And so I did a lot of things that were, laundry, and I bothered Dr. Wilson on a sabbatical. I'm like, I know you're supposed to be, focused, but could you talk to me? And trying to figure this out, and also then healing myself.
That's right.
Because the other thing that is not uncommon for folks who sit in policy seats or in those agencies directing that work is that we've actually lived and experienced the systems ourselves.
That's right.
So born into foster care, adopted, grew up in a community and a family where I was the only brown person in Iowa. I'll give you a little bit more, in Iowa. So, and then I went to DC in the late 80s, so that's a whole other thing. But just thinking about, we're in here and we actually need to heal. Yeah. Because I know as a caseworker and things like that I was not a good caseworker. Because I was following the system and didn't know that I could actually not follow it. And so moving into leadership roles, I didn't want the job. The White House called me and said, we'd like to consider you for, and I was like, I don't know. And then I thought about it because there were some things I'd been trying to do as a child welfare leader that the feds kept telling me, no, you can't. And I'm like, well, I can, and here's my, I had nice lawyers that put it in nice, official legalese. And they kept telling me no. And I was like, okay, I'll just come and fix it myself. And so there's opportunity in that, but we actually have to do some healing because we can actually do more harm if we actually haven't taken care of ourselves.
I want to go back to something you said earlier when you started addressing this question, how those who are most impacted, their voices are not, thank you, at at the table, or you wanted to make sure they were there, but it was challenged. People resisted. What did you do? How did you create the spaces and ensure that those who were most impacted were in those spaces?
So a couple of things,
Yeah.
And depending on the rules in the jurisdiction,
Yeah.
because I wanted people to actually be paid like everyone else
Right.
at the table, and there are lots of rules about not being able to pay people who actually are part of your system. And so I initially, in my early days, would contract with other entities, outside entities, to do it, because I also wanted folks to have a place that was safe,
Right.
to have time and ability to get prepped for sitting in meetings where people use, language and talk about people in sometimes unkind ways.
Right.
And wanted folks to feel like they had their armor and protection. And so doing that. And then because of my own lived experience, I was able to, because people had some level of trust, people would identify themselves within the organization and say, oh, I actually spent time in foster care, or, oh, I lost my child, or I had a family member, complete suicide. All these sort of things that we've all experienced in our day-to-day lives, feeling safe enough to say it, and how do you use your voice? And to me, an important piece of it is, I don't need you to actually tell me your story. I'm happy and honored to hear it, but that's not a requirement. I actually just want you to have your lens at the table.
That's right.
Because I just shared a little bit of my story. I was also a young single parent, angry black woman, and had lots of opinions. Hard to believe, I know. But I, in my own journey, went from talking about all of the harm that had happened to me to just showing up and saying, I don't agree with that. Here's what I think we need to do. They don't need to know that it's because it's something that I personally experienced. It's being able to kind of sit at the table with the authority of your experience being the accreditation that you need to be at the table in a way at an equal basis.
Now, both of you have mentioned, as you were recounting the times you've encountered first responders or those who were on the front lines of, giving care, how they have not been sensitive to the needs of the families that we serve. Where does that conversation begin? Because I think about even in my own training, right? As a school psychologist, you had a few courses. Some of this should be just kind of intrinsic, right? But what is it that we need to, what are the conversations we need to be having for those who are on the front lines?
Yeah, I would say this. There is a real space, a real need for training. I mean, how many of us have volunteered at something and that you just showed up and they said, well, just go and serve?
Yeah.
Everybody's not ready to be serving behind the table or wherever the case may be. So all of our organizations need to take the time to really train folks, because the person who's giving out that bread that day could have a significant negative effect on that mom who's bringing her 3 kids and just trying to hold on for the day. So I think there's a real space for that kind of training, and that's not the formal go to college and get. That's
right.
just having somebody. And my dad used to tell me, common sense ain't that common.
Right.
And and he was really saying something about me, but that's another conversation. Lord, how did I make it? But anyhow, the point I'm trying to get at is sometimes that sort of human decency is missing.
Right.
And so that's one side of it. But the other side is people, when they come to these spaces, and I think about these what are sometimes referred to as street-level bureaucrats, the caseworker at the SNAP office. Do you know how many cases they're having to deal with?
Yeah.
Do you know how many people they're having to manage in that time? I mean, even the best of us would be losing our mind trying to manage this. And I've never done that work, but I've listened, and I know it's a challenge. So one, the training is necessary. Even in a community-based organization, someone needs to stop, slow down, and think about what are we doing and how do we do it. I'll give credit to the Freedom School students that are working with. I went to the thing yesterday with my daughter. There is such enthusiasm.
Yes.
Such love. My daughter was like, I don't know about this. But I'm not worried about her because I know that those folks are going to care for her.
That's right.
They've been trained. And they were picked because they are compassionate folks.
That's right.
So for all that said, I think that's where I'd love to hear about the professional work of that.
Yes.
Yeah.
So, a couple of things is anyone working in these systems is highly regimented in what they are supposed to do. You get a checklist. The SNAP workers, the benefit workers have a quota. They get timed in how much time they're spending with people. None of these things actually support actual real human engagement in a real way. So know that they are working against a system that actually isn't allowing them to actually be the human that someone needs across the desk. And that's really important. And I'll say learned a lot in the pandemic around also how poorly how the staff were getting treated by the community coming in and asking for help. And I'm not saying some of that wasn't justified in being frustrated with what was happening, but if we're actually not having human-to-human interaction, we are not seeing each other, we're not listening, we're not actually meeting each other's needs. And so it's challenging. Child welfare workers are getting burnt out because they're coming because they want to help people. They want to help people, and then we don't, as the agency, give them the tools they need to actually do it. We're like, this is how much time you have to do this, this is the thing. And you also have to think, and this is where, again, I think is really important for us as community to dig into what are those actual actions and things that these systems are doing. So the tools used for assessment, not surprising, oftentimes are slanted to actually to the detriment of communities of color. Where a question might be, who's in the home? Single parent. How many children? Or it's multi-generational home, and somehow that's negative. Which in many of cultures, people of color, multi-generational was the requirement.
That's right.
And to me, it's also well-being and safety,
That's
right? So it's understanding the parts of the machine and the mechanism, and then it's providing the cover for the folks that are doing the work when they're doing it well and doing it right. Because they are going to have to fight a battle inside. I, as a beginning caseworker in DC, first of all, I didn't want to do direct service. That's a whole other story. My mother was a nurse. I was like, I don't want to be a nurse. I don't want to work with people. So I became a social worker. So question my thought process. But went to study. I wanted macro. I wanted policy. I wanted this high-level system-changing thing. And I sat down graciously. The woman was gracious to me. She was sitting in a role in the federal government that I had no idea what level she was at, and she was at a high level. She sat down with me and let my 20-something self come bounding in there, tell her my life story and all the things I'm going to do and where should I go get a job. And she just sat, she's like, I love your passion. And I was like, thanks. And she's like, you should actually go do the work first. And I, being the 20-something I said, nah, I'm good. I just want to change things. Well, guess what? Nobody was hiring me to be anybody's boss. Thank God. I actually ended up having to do the work. And my understanding of what it is to be a caseworker who this was before email and computers at workers' desks. I was handwriting everything. You had to type up your court reports, hand deliver them, all the things. But I am an A student. I'm gonna do the things that are required, just don't ask me how they happened.
That's right.
So I knew when delivery was, I would go get my little ream of paper and lock it in my desk. I would, as a worker, responsible for getting parents and children connected for visits. They'd been separated through foster care. I go to the carpool to pick up the state car, and they're like, all the cars are gone. So protocol is that you then have to cancel and reschedule the visit. And I was like, that doesn't make any sense. I was like, no, they have to see each other. So I drove them around in my little black Ford Escort with the sunroof. I know, I thought I was fancy. Doing these things because I thought it was the right thing to do. As an administrator, looking back, I'm like, oh my God, the liability, all the things. But had something happened, I have no doubt that the foster parents and the parents that I was working with would at least have spoken up and said, but she's made sure that she's done these things. And that's what organizations need from community. We need to know how that stuff works, talk about what's not working and what we think needs to change. And then we also need to, when people are pushing against the machine that has been in place for decades, we also then have to show up for them and say they actually are responding to what we ask them to do. And that sometimes is unpopular, but that's what we've got to do if we actually want to impact change.
Absolutely, absolutely. That's good. That's good. So going back to some of the prevention talk, what gives you hope that we can move from crisis response to prevention-centered, equitable care for children and families? What gives you hope?
Y'all.
Okay. All right.
I think whenever I'm talking to folks that are in the community doing the work, the social activism that's happening on the ground, that is what is helping me wake up every day and say, okay, let's go. This part of the world is crazy, but we got work to do. Let's roll our sleeves up. Because I think that that's actually where the change is going to happen. And it has to, right? Because no one at the top worries about what's actually happening on the ground. And so we've got examples in history of where that's happened. So we need to actually draw on that and become organized, and in many ways go back to this concept of neighborhood and community and being responsible for each other, changing the conversation about what mandated reporters actually have to call, because most mandated reporters are calling just because they're worried about kids. They don't necessarily want children to be separated from their families, but they don't know what else to do. So what else is there for them to do? Do you have family resource centers? Do you have churches that are doing after school activities? How are we in the community creating the things that we know are needed? So we know most of the answers. And that actually is what is going to build the armor that protects us from the onslaught of what's happening at the federal level. And there are people in these systems that want the same thing you do. So how do we build the relationship and connection? We don't all have to agree, but it can't be us against them. It's what are we creating ourselves? How are we pushing the systems to change and benefit what we need? And then when are we what are we going to do to stand up and fight against with the mechanisms we have in the formal fashions that we have in the political and national space?
Absolutely.
Yeah, I'll pick up on this idea, and I'll reference something that happened during the pandemic, and then I'll actually reference my grandmother. During the pandemic, I actually was doing some work. A colleague of mine was going around. I was living in Boston, or we were living in the Boston area, and noticed these little you know, the little lending libraries that you'll see around towns. And she noticed that the one that was near her house actually had food in it. And so what she discovered is that there was this network of folks who were just putting food in these libraries for individuals to get food out. And folks were just kind of putting things in and taking things out. Because while the food pantry system, that network was still working, they were stretched. And all the systems that had been in place were falling apart because you couldn't go in. You couldn't be in the same physical space. This was a place that allowed people to get food as they needed and to give food as they could without anyone sort of organizing it in this super complex way. And so this idea of mutual aid, I mean, this is exactly who you all are. You are part of mutual aid societies that are providing support to one another in ways that are innovative and decentralized and simple and beautiful. That gives me hope. You know, it was funny. It's a funny thing how you remember things about your grandparents and you didn't understand it at the time. So my grandmother was a part of something called, she was a part of a Baptist church in Georgia, and she was a part of something called Band of Faith. And I didn't know what this Band of Faith thing was. So what Band of Faith was, for the most part, was a group of church women who would travel around to each other's churches through multiple counties. I don't even remember how far they went. And every time there was sort of a devotional, and they would give a little bit of money to this Band of Faith organization. And so when anyone died or anyone was sick, the Band of Faith gave that person money. It was a form of insurance that I just didn't even know existed. This was a way for community members to care for one another in these, again, decentralized, simple ways of realizing I need you and you need me. Yeah. And I must say, as someone who's at the university and I do these things and I talk about these big systems, I'm learning more and more it's this kind of work that's going to hold us through these difficult times. Yeah. You know the old saying, fool me once, shame on you, fool me twice, shame on me. And I'm looking at things at the federal level and realize, shame on me that I believed that this system was going to be the only way that we were going to meet our needs. And I'm now realizing more and more, and I'm not there yet, and I'm still trying to figure it out, but we are going to provide the support that we need. And I'm grateful for the work of people in community.
Can I say one? I'm sorry, Brandy. So thank you for that. I love that, because that's exactly what we're talking about, right? So kinship care. And I remember I was a young single parent, still in college, working a full-time job. And this woman, I was pregnant at the time. I was riding the bus, which there weren't public buses in Iowa, so this was a new experience for me. Riding the bus, and I'm big and pregnant, and because I needed a trash can. And this woman comes up to me. She got off at my stop. It wasn't her stop. And she said, I have a licensed child care. I'm a licensed child care provider. Are you looking for child care? And I had literally just received the list of licensed providers in the mail that day. And I was like, yes, I need a child care provider. And so she was amazing and loved up on my son and all the stuff. And I would come and pick him up, and she would send a plate of dinner home with me. And I didn't recognize it at the time, but she was making sure I was okay.
That's right.
Because at that time, I wasn't telling anybody I wasn't okay. Yeah. Because I was waiting for someone to say, you made dumb choices, and this is the consequence. So I wouldn't tell anyone, but she just would send food home. She's like, don't worry about sending diapers, I got it. And so those are the things we can do individually that actually have profound impact. And you think about the stone in the pond, right, and the ripples. That absolutely is what we have the ability to do, and we don't have to wait for folks we don't know to care about us. We actually need to care about each other. And call each other on our stuff, because we got some stuff, community. And we need to let everybody who is in our community be in our community in the way they need to.
Yes. Beautiful, beautiful. Well, I don't want to take over, and ask all the good questions, so we do have a few minutes to take a couple of questions from our community. Anybody want to ask a couple of questions? I don't see any mics anywhere. Oh, we got one here. Come on, let's go. Come on down. I'll make you work, Randy. I'm going to work. I'm going to get my steps in. Getting my steps in, y'all. All right. Come on. Come on.
Thank you. I actually wasn't going to ask the question until your very last comment. My name is Hannah Naomi Jones, and my question is around how the lady provided diapers and meals, and it just quickened and reminded me. My children are 21 and 19, and I often remind them of the care that they received. I was part of liturgical dance ministry, and this woman, Kim, would pack dinner. I worked at the university, and she fed and made sure my kids had dinner before practice, the dance ministry practice. After church, the pastor and the first lady would take us to dinner. On Mother's Day, when my kids were little, a woman sitting next to me put $20 in my hand. And with all these systems crumbling, including foster care and all these things, how do we, in an organized and movement-building fashion, actually make this our advocacy? My children stand, they're not here, but they are where they are today because of all these acts of care. Okay? And I don't want them to be just random. I think this needs to be intentional because everything is crumbling around us. I stood in line at 6 a.m. to get a box of food once a week to feed my kids and make breakfast, and they had no clue that I left. And I was working in higher education. I'm 41, and you don't see the scars of the life I've had. But all those, I wasn't going to say anything. But that last moment, I'm hoping that we actually turn this into a form of organizing and movement building and this community care. And I talk about always this new underground, digital underground railroad and moving information and resources in this way. So I'm hoping you all can maybe answer or speak to how we can organize around this type of community care and mention all those, notice all those moments were from church that I mentioned. I did also have ladies at the university. I was at predominantly white universities, and the black faculty staff were my sisterhood, my brothers, but they also were part of the black church, and they also watched my kids while I would present and teach. And the university kids would help my kids with their homework. And the after-school programs I helped design at the table because there was not any. So I just wanted to mention that and see how we can turn this into a movement for such a time as this.
Well, if I'm not wrong, I know there's some conversations coming up this afternoon to engage in just that. But some of it is just starting where you are. If you're part of a group, if you're a neighborhood, you could organize your block. You could do it at church. You could, do it connected to the parents connected to your kid's school. It just takes one person. Right. The example that you gave about food, it reminded me in Portland. I was like, how come there are refrigerators on the street? Because I was always taught, if you're getting rid of your refrigerator, you're supposed to take the doors off, right? But these are there, and they've got notes on them. But it was food. It was food. And then there's the libraries and the children's books and the uniforms for school and all these sort of things. We have the ability to do it. And, the one example I'll share is I had the opportunity to get to know this organization, and it had historically, for over 100 years, provided group care for kids in foster care. Started out as an orphanage, and then it was like group care. And they collectively, their board, their staff, decided, we actually don't think we're having the impact that we want to have on children. And they said, we're not going to do this anymore. and they completely changed, where they then, using data and that sort of stuff and some philanthropic support, adopted a school district that had the highest number of reports, highest number of domestic violence, all these sort of things, and they created this community network where they do educational things for the community, and it's just the community coming. You don't have to say, oh, I needed this. And they send every child home in the elementary school with a bag of groceries on Friday. Every child. They don't say, do you need it? They send every child home. They turn to the nurse's office into a public health office where then parents and kids could come and get prescriptions filled and medical care. The absenteeism went down drastically. They created a walking school bus where community members walk along and pick up the kids from the front of their building or their home and walk them to school to make sure it didn't cost anything, right? So we can do this. We have done it before, right. So we need to, I think some of the reflection is, why aren't we doing it now?
Right.
I'll just pick up on that point really quickly. When I was doing that work with the Little Free Pantries, one of the things that became clear is that people start noticing it. And they start calling each other up and saying, I see you're doing this thing, maybe we can coordinate, maybe we can work out something where we can support each other. And the whole point is, even if you're doing something that looks small where you are, there's probably someone else doing something similar. Call them. Call them, make the connection, and see if you can make that work happen further. But because we were talking about care work, and I'm going to say this, and I'm just going to say it, most of this care work is being done by women, and men are not doing their part on this part. So I'm just going to encourage the fellas that we have a role to play. We too are fathers. We too care about these kids, and we need to be in the fight with these women.
Good.
What's good, everybody? My name is Q, and I like to consider myself a bridger. I would be considered a millennial, right? I come from old school where I had a village, but I come from the current, right? One side of my family was church, the other side of my family lived in the projects. So I saw the best of both worlds, right? Currently, I work for an academy. And I'm struggling, because one day I'll be like, I don't like kids. I keep saying it, right? I went off to school, to seminary school. I'm a seminary student, and I decided I'm just going to take a risk, and I'm going to leave. I had just become an 8th grade science teacher in Texas, where sports rule and academics don't. And I came in a 6-month period, never being a teacher. Never have I been a teacher, right? Walked into it, and these kids, this was a D-rated school. Kids suffering in science had a 5-people turnaround for just science. It was the first time that the kids had ever passed their test for science. And here it is, I have the audacity to go and further my education, right? That would be a great time for me to take the clout and be like, yeah, I did it, right? I left, now I'm back with kids. I don't know, don't mind your business.
When God speaks,
you can keep all that. I keep ending up with kids. Now, I am a mother, but none of my children are biologically mine. My 6-year-old son is here, and I've had him since he was 1, right? My question is, I work for an academy where the company is owned by Somalians and Jews. The demographic is poverty. My academy is literally attached to the hood store where they sell weed right in front of the academy. My director is black, but my director doesn't fight for my kids. I'm a co-teacher for toddler 2s. And I have only been there since April 7th. Within less than 120 days, I have watched my director's daughter's husband walk into the academy with a Glock, going after another parent. I have watched parents fight outside of the academy. I watched a little girl come in with a swollen right eye. My director says to me, I talked to the mom, and she said it's allergies. I looked at her, and I said, the hell? What allergies? And one eye, swollen and black. As a person who works with children, you are automatically a mandated reporter. In the state of Ohio, this is my battle. In the state of Ohio, there's an anonymous number that you can call to make the report. But the battle is, I have coworkers who I just went off on before I left to come here, okay? I don't mind it. I cuss for free. I went off because as a mandated reporter, my job is to tell my director, but I'm not waiting on my director to make that call. Right. The problem is people are afraid of losing their jobs because it's a struggle to get a job. So the gamble is, do I really protect these kids, or do I keep my job to protect and feed my kids? Also, I work in Ohio where you can call, but the problem is, in Ohio, they call you before they come. So you can fix it. You can make it look good before they come to your house. I'm stuck. Yeah. And the reason I say I'm stuck is because I love to flip tables. I love to shake up, sorry y'all, I love to shake up shit. And I'm serious. I don't play about kids. Because at one point, CPS was called on my own mother for child abuse. Yeah. And I'm watching kids that don't eat. I'm watching kids that don't get a bath. They played with marker on Monday, and on Friday, they still got the same marker. Yeah. So what do I do?
Oh, if only it was easy. Yeah. First of all, you're doing the right thing, lifting your voice on behalf of children. Here's the thing. The child protection system isn't built to work. It was built to make some decisions, deserving, undeserving, and it has one lever, separation. It doesn't have, and I've heard a lot from mandated reporters of, well, I called and y'all didn't do anything. I'm like, yeah, because it wasn't abuse. So when I talk about like the community and the systems don't work together at all sometimes, or very well together, to actually help someone that needs it without it being about, did you actually harm your child, physically harm your child, or harm your child, and per statute definition, right? Now, the calling beforehand, that came from the community. Many, many years ago in Ohio, particularly around alternative and differential response, because CPS was showing up bang, bang, bang like the police. And so in an effort to actually try to have a softer response, it's a call. But it's imperfect, right? It's imperfect because the bottom line is the system is never going to be able to do what it is that we're supposed to do. And I can't make a decision about stay or go. That is up to you. But we need people who are fighting within, holding the system accountable, but also willing to work with the system about something different, because what we're also trying, the folks, trying to transform the things that exist in many ways, is trying to actually get them to work better together. So TANF, Temporary Aid for Needy Families, cash assistance, the first tenet in the statute is help keep children with their families. But it becomes about, are you working enough to get this assistance, right? And so being able to do that, and that's where paying attention to the political conversation, I think, is important. And we're not powerless on the ground because each state makes its own plan for how they're going to do Medicaid, how they're going to do TANF, how they're going to do child welfare, and it is not uncommon that those three entities have actually not worked together in creating their plans. So I think there's some opportunity around understanding. I like to understand the machine to know how to attack it, take it apart, and make some decisions about whether or not we even want to rebuild it, right? I'm going to say some advice that I got from a mentor of mine when I was leaving my very comfortable philanthropic job to go back into state service. I was asking him, because I just wanted him to tell me I was going to be great. You know how you ask someone and you just really want them to, like, you know, stroke you up? Yeah, he said, you need to check yourself, because sometimes how you enter a room turns people off from wanting to actually engage with you. But the piece of advice that he gave me that has stayed with me, and I have it on a little piece of paper and I put it up everywhere I move to in my career, is don't work so hard to keep your job that you don't do your job. And it has been a reminder to me, because it is easy in systems and things to get caught up in the thing of the day, and you forget what it is you're actually there for. So I offer that to you.
Okay. All right. One more brief question.
I do have to say, when you were saying we used to do this, what happened? So as a Puerto Rican, and we know how the federal government came in to create a dependency so that they can take over the country. That's what's happening here too, right? There's a dependency that's created that's never been put in place to actually care for the people. And we shame the people for needing support. But what I do want to say is, I do not believe in food banks. I think that they're created to centralize things. I run an organization that provides free meals every single day. Sorry. We actually are not part of the local food bank. They dropped us because we don't order enough food from them, because we have a wonderful system where our partners help to provide the food. So we don't have to buy the stuff that they collect from around the state that's left over from someplace else, so that they can get some money that goes back into the system. It's a money-making system, and it's flawed. And when I first got into my organization, the Chicago Food Depository was tiny, and I was on their advisory board as a community member. And when I asked, how do we make sure we don't keep losing money to you all, because our funder now is given to you because you have a bigger impact than we do, they stopped inviting me to the board meetings, okay? So it really was not about how do we, but we're listed as the ones that help the members that help them feed the community. They're not feeding the community. We are feeding the community. So we need to figure out a way to get them out and get that money directly to the people on the ground doing the work. And I want to say that in our organization, anybody up in here can come in and eat. We're not going to ask you, do you need it? We're not going to ask you why you here. We're not going to say you look too good. None of that. We're a community kitchen, and everybody can come in. We have both volunteers from the wealthy congregations and from the community. All our staff comes from the community. All of them. A Just Harvest in Chicago. Look us up.
All right. Thank you. Thank you. All right. So that was the question. All right. So we. Okay. Well, I tell you what, we will hopefully have some time after to address, but I want to make sure that we, in the essence of time, give you all the opportunity to, kind of in one sentence. Look, she laughed. What action can our attendees, our faith leaders, caregivers, advocates, what can we take to help children grow up whole in body, mind, and spirit? One sentence.
We have a responsibility to do it, and it's possible. So just do it.
All right. Look at that.
I think we also have to acknowledge the power that's within us to actually affect change. It's so easy to think that we can't, that we don't have the resources or the training or whatever the case may be, but we keep seeing time and time again individuals who are creating their own spaces to solve problems in their communities. And that's what I would encourage us to do, to believe.
Thank you, thank you. So we are going to just do it. That's what we're going to do. So Reverend Marvin, Lauren, you're going to help us just do it. Do you want us to stay or? Okay, can we give our panelists a round of applause here?